Hi, my name is Blake Neblett. My goal here today is to try and better inform you on how to identify venomous snakes of Tennessee. According to the University of Florida, there's over 8,000 snake bites annually in the United States. Living in rural Montgomery County myself for over 25 years and being an avid outdoorsman and hunter, I've come in contact with many venomous and non-venomous snakes. Most of the time I would try to leave them alone if they didn't have any effect on me whatsoever, but it's always good to know which ones can kill you or severely harm you as opposed to the ones that can't. I'm going to try to cover the distinctions between the venomous and non-venomous snakes, the main body characteristics, and other things to look for, as in colors and body length and size and shape. Some of the distinct features that you'll find on venomous snakes is most of them have large triangular shaped heads due to the large venom glands that most of them have. They'll have vertical or elliptical pupils. They have several of the snakes we have here in the United States, and especially for Tennessee, have rattles. Obviously you'll see those rattles and they're used as a warning system, everything like that, to let you know that they are venomous or dangerous. Most of the snakes here that we have are venomous have real heavy bodies. They're either short, thick, real stout snakes. They also can be told by a single row of scales on the bottom of the side of the body. All the non-venomous snakes have two scales that are put in rows all the way down their body. This is a lot better to identify after they either shed their skin or they're dead. The two types of venoms that snakes use is neurotoxins and hemotoxins. The hemotoxins affect the blood, tissue, organs. They are more painful bites, but usually less deadly. The neurotoxins attack the nervous system, as you would imply from neurotoxin. It also makes it shuts down your circulatory system, everything to that effect. Usually the more deadly and serious, can cause seizures. Most snakes have both. It's hard to characterize one as having neurotoxin or hemotoxin. It's usually just which one they have the predominant as in, and that's what they're classified as. First snake I'm going to cover today is the northern copperhead. It's viper. It reaches about 24 to 36 inches in length. Its color is tan, pinkish color, and has hourglass shaped saddles, as you can see here, going across its body in more of a darker copper shaped color where it gets its name. It is the least venomous of all our Tennessee snakes that are classified as venomous, but it also accounts for more bites than any other venomous snake here. The next snake is the western cottonmouth, also known as the water moccasin. It is a dark colored snake, usually black. Can have different types of patterns on it, but usually it's a really dark shape or black. All snakes have a white colored mouth, which is a misconception that you'll have the cotton mouth. The only difference is it normally postures with its mouth open, as shown in this picture. So it's a very important characteristic of the snake, that it usually will also stand its ground. Most snakes will try and evade, get away from you, leave you alone. This one tends to stand its ground and will posture with this aggressive mouth open stance. They usually reach 30 to 42 inches, have an extremely heavy body. They are found along the west of the Tennessee River, along rivers, lakes, creeks. Can bite underwater, something to keep in mind if you're swimming. They usually travel with their head lifted above the water, but they can dive down because they are feeding on fish and frogs and other amphibians. The next snake is the timber rattler, one of our two rattlesnakes indigenous to this area. They live in heavily timbered areas with large, heavy bodies, 36 to 60 inches long. The color is a pale gray. Will have some tan in there. They also are equipped with that distinctive rattle on the back of their tail, which used when threatened to let you know they're there. It doesn't mean to come over here and check me out and mess with me. The next snake is the pygmy rattlesnake, also found along the floodplains of the Tennessee River, swamps, marshes. It's a very rare snake and is listed as endangered by Tennessee Wildlife Resource Agency. Rarely exceeds 20 inches, very small. Also has that rattle. Still, even though its size, very dangerous and deadly. All of these snakes so far have are classified as having hemotoxins, which, like I said, are very painful. The only snake that is known to be in this area that can frequent Tennessee that has a neurotoxin is known as the coral snake, which most people are familiar with having red, yellow, and black bands along its body. Usually a very small, slender snake, very dangerous, a member of the cobra family. There's another snake that looks similar to it, which is called the king snake. It's a non-venomous snake. The difference between the two is with the venomous coral snake, you'll find the red to yellow, the red and yellow band will be touching each other, which will tell you the old rhyme, red to yellow, kill a fellow. If it's red to black, as known on the king snake, they will say red to black, venom black. All the snakes other than that one are known as vipers, as in rattlesnakes. An important fact about those is 50% of all defensive strikes from a rattlesnake, viper, or that effect are dry bites. They have the ability to not inject venom or not allow venom to be injected into their intended victim. This is mainly for the venom conservation. It takes them several days, maybe even a week, to regain that venom, and they need that for hunting and killing. So if they can, they will bite without that. Most of them will try to get away from you if you leave them alone. If it happens that you're unable to do so or happen upon these and you are bitten, the number one thing is don't panic. All right, the best thing to do is try to ID the snake without messing with it any farther, because you can be bitten again. ID the snake, color, size, shape. Most people have phones with them. Take a picture of it if you can. Then call 911. You can wash the wound. It's best not to try and drive yourself, because it does affect you. Now you've just run into a possible wreck if you would go unconscious or anything to that effect. Common misperception: do not try and suck out the venom. Most venom can still be on the surface of the wound. Now you have venom in your mouth, which can also cause severe damage and further complicate matters. The best thing to do is just be able to identify the snake, know what you're dealing with. Out of the 8,000 bites a year, there's only 8 deaths. Those are due to certain allergies the person might have had, or to the anti-venom. Some people find they have a severe allergic reaction to that, and which can help if you know what kind of snake you've been bitten by, to what type of antivenom you need. Proper medical care is available for most around here, so as long as you get that within a reasonable amount of time, you're going to be okay. Hopefully with this information I've given you today, you're able to identify the snakes you come across, and if you are bitten, you're able to identify which type of snake it was, which will greatly enhance your chance of survival. I appreciate y'all sitting here today.